Hello, my name is Dr. Derek Mwanje. I work at Value Family Hospital, and I'm very glad to be sharing with you today about pressure in pregnancy, given that it's one of the very serious problems that many women are facing these days during pregnancy. And of course, we know that knowledge is power. So when you know, you will definitely act better and of course take the right course of action. So we want to know what is pressure in pregnancy. We must be knowing that the normal pressure is 120 over 80. You know, the systolic 120, the diastolic 80. That's the normal one. Of course, sometimes we can also say your pressure is a bit elevated. If it's about between 120 and 129, then that's elevated. You're not hypertensive, but it's an elevated pressure. So any pressure above 130 systolic and above 90 diastolic, then we say you are hypertensive. Now, during pregnancy, there are many women who are at risk of getting pressure of pregnancy. And there are two categories. There are those women who get pregnant when they already have pressure, what we call chronic pressure or chronic hypertension. And this category of women is also very interesting, because we diagnose pressure in pregnancy when a woman has reached 5 months, or we call it 20 weeks, though many people prefer counting in months. And that's about 5 months. So if you come to the hospital and you're pregnant, first of all, always ensure that your pressure is checked. And we find that your pressure is above 140 and 90, but you are not yet 20 weeks, then chances are high that you are chronically hypertensive. That even if we are discovering for the first time you didn't know that you are hypertensive and you're pregnant, you come before 5 months of pregnancy, we find that your pressure is above 140, 90, then we shall say you have been really hypertensive. But when do we diagnose pressure in pregnancy? We diagnose pressure in pregnancy, the one we say is because of pregnancy, when you are beyond, when you are at 20 or more weeks, or when you are beyond 5 months. And that pressure has several categories, which I'm going to briefly share with you so that you can know, so that as you go through your pregnancy, you are able to also detect anything that is out of the normal. Now, you're going to hear new terms. Probably you've heard about them before if you've been pregnant. But if you're hearing them for the first time, no problem. There's what we call pregnancy-induced hypertension. That this pressure has come because of pregnancy. Now, we've said that if before 20 weeks, if your pressures have been normal, and now we are seeing a high pressure for the first time, when you are 20 weeks and above, then we can say that is a pregnancy-induced hypertension. And that is usually when the pressure is above 140 and 90 and has been measured on two separate readings. You know, sometimes when you come in the hospital, maybe you've been walking, the pressure may be elevated. And so the nurse or the doctor takes your pressure, it's high, 140, 190. Usually, what we do is that we first tell you to rest and then we repeat the pressure, or you come back later, like 2 hours, and repeat the pressure. So if we find that it's consistently above 140 and 90, but then you don't have protein, you know, for pregnant women, you know, one of the commonest tests we do in pregnancy is the urinalysis. If you're pregnant and your doctor doesn't do a urinalysis, please don't mind, you should remind him. So when we do a protein check, a urine check, we find there is protein, we find you have a very high, you have a pressure of 140 out of 90, then we know that now you're going into another phase of the pressure called preeclampsia, okay? If you only have pressure, 140 over 90 for the first time, and you are already 5 months into pregnancy, we just say that is pregnancy-induced hypertension. But if on top of that, you have a pressure of 140 and 90, you have protein in your urine, or your pressure is 160 over 110, that is preeclampsia. Okay? Preeclampsia and sometimes we can say it is preeclampsia with severe features, especially when now this pressure started damaging some organs. Okay, and how do we know that the pressure started damaging some organs? The woman comes, the pressure is 160 over 110, or it is 140 over 90, but they are saying, I have headache, I have blurry vision, I'm not able to see very well, my stomach is paining. Okay, then I know that now this pressure has started damaging some organs inside. And of course, the management for such a patient is urgent, because this mother, you really need to address that very fast. Now, the spectrum, because it's a spectrum, pressure in pregnancy is a spectrum. And the highest level is what we call eclampsia, Now, this is when this pressure, this high pressure in pregnancy is starting to affect the brain, okay? And you find that the mother starts convulsing. If you've heard about that or you've seen someone, pressure is high, they're convulsing, that's an emergency. You want to attend to this mother very fast and you want to deliver them very fast, okay? So that's a spectrum of pressure in pregnancy. But then there's also another interesting category of what we call postpartum preeclampsia. This is when a woman has finished delivery, okay? Pressures were normal throughout pregnancy. But then in those 6 weeks after you've delivered, then your pressure starts going high. We still get worried because within 6 weeks after delivery, a woman is still prone to several complications that are related to pregnancy. We call that period puerperia. That's why always, even when you've delivered either by cesarean section or vaginal delivery, you will be advised to be coming back regularly for a check. So now we've seen the spectrum of the different scenarios of pressure in pregnancy. And we want to also look at who is at risk, okay? Because pressure in pregnancy, like I've highlighted up there, it's a growing problem among pregnant women, and always your doctor should be on the lookout for it. And so we know that women who are a bit young, if you're below 20 years of age, or you're above 40 years of age and you get pregnant, the risk of getting pressure problems in pregnancy are quite higher than someone who is between those age brackets. Then we also know that if you've had a pregnancy before and you had pressure problems, chances are high that even on your next pregnancy, you may have pressure problems. Then we also know that women who are a bit extra size, the risk for developing pressure-related problems in pregnancy is high. If you have twins, okay, twin pregnancy or more children, if you have twins or more, then the pressure is also very high, because as we are going to see, that one of the causes of the pressure is related to that sac or that bag where the baby is eating from, is getting nutrients from the mother from. Usually that's where the problem is. So if you have twins, meaning that that bag is a bit bigger, so it's going to cause you it's going to put you at a higher risk of getting pressure in pregnancy. And then also family history. If you have close relatives, your mother, your siblings, your close siblings who are having pressure problems in pregnancy, then chances are high that you may get pressure problems in pregnancy. And also, like we've already seen, that if you're already hypertensive, a woman who gets pregnant when they already have pressure, and then they reach that age, that bracket of 20 weeks and above, chances are high that this chronic pressure may worsen a little bit, and we usually call that preeclampsia imposed or added onto the chronic hypertension. So those are some of the risk factors that are going to pre-expose you or predispose you to developing pressure during pregnancy.